Welcome to the Expert Roundtable podcast, where we connect frontline clinicians with top thought leaders to facilitate discussion on key issues they face daily.
Podcast will focus on immunoglobulin A nephropathy. We're joined by Dr. Richard Lafayette. Would you like to introduce yourself?
Sure, I'm happy to be here. I'm Rich Lafayette. I'm a professor of medicine at Stanford University Medical Center, and I run our glomerular disease clinic and center, and have lots of experience taking care of patients as best we can with IgA nephropathy.
Our topic will be the overall impact of IgA nephropathy on quality of life. Dr. Lafayette, can you begin by explaining what IgA nephropathy is and describe how it adversely affects different aspects of quality of life in your patients?
Sure, I think that would be great. So IgA nephropathy is the most common glomerular disease in the world. What that means is that in the United States, about 6,000 to 8,000 people develop this disease every year, and probably about 150 to 200,000 people have this disease. It impacts patients because what is happening is it's an autoimmune disease, where antibodies deposit in the kidney's filter and lead to inflammation. And even that subtle inflammation in the kidney often does lead to changes in how patients feel. Most broadly discussed is fatigue. They just don't want to get up in the morning, don't have their energy to complete their tasks. They may have some direct symptoms, like they may see foam in the urine, they may have some swelling of their ankles, but the fatigue is often the greatest problem. Interestingly, when the patients are very carefully evaluated, they also have pains and aches, often with back pain or flank pain and discomfort, and just, again, not the energy to do their daily tasks. As their kidney disease may progress, and often does in patients with IgA nephropathy, where at least half the patients can progress to kidney failure in 10 to 20 years. They can have further losses in energy, attentiveness, ability to keep their job, ability to interact with family members and friends, and it can have progressively devastating impacts on their quality of life.
What about caregiver burden? Is this something that you see?
I think there are concerns, for any chronic disease, which is threatening to put people on dialysis and further impair their life. Often patients with IgA nephropathy do rely on their caregivers. They're also a little bit more anxious about their loved ones and family, and eventually there can be requirements for them to help them come to clinic, help them with daily activities, help them come to the hospital if they get acutely ill with cardiovascular complications or infections, or if they end up needing to go to dialysis or transplant. The burden on caregivers and family members can be quite significant.
When a patient comes into your clinic, how do you assess quality of life directly, or is it just something you glean from them? Or
yeah, it's something I don't think we discuss enough with our patients. They sometimes keep it hidden, and it's only apparent to family, caregivers, friends. But what I certainly try to do is always start with very broad questions about how you're feeling, what's life like, see if medications we're prescribing them are impacting on how they feel. But it's really nice to go a little bit further and ask them, what are they doing day by day? Are they participating in their job? Are they participating in activities with their family and friends? Do they have get up and go? And we do something called a review of systems in clinic, again, asking them about pains and aches, other symptoms to their body, any GI issues, any issues in urinating. So sometimes we do get a good flavor of what's going on in their lives.
What about treatments? Can you talk a little bit about how treatments change the quality of life? I mean, do the treatments improve or worsen different aspects of quality of life more than others?
Yeah, I think it's a tough disease because I think our treatments are designed to really protect the kidney and protect the kidney from further inflammation, protect the kidney from high blood pressure impacting on function over time. So the medicines we use often can adversely affect quality of life, because blood pressure drugs, particularly we use these medicines which block the renin-angiotensin system, can lower blood pressure at times, again, adding to fatigue, adding to lightheadedness, adding to a sense that patients' heads are just not in the game. So we have to watch very carefully for that. Traditionally, when patients had bad inflammation in the kidney, we would use corticosteroids, and corticosteroids are infamous for a lot of side effects, including changes in emotional well-being, difficulty in sleeping, cognitive issues again, potentially upset stomach with unremitting hunger. So we really have to be cautious with our historic and traditional medications, in that blood pressure variability can lead to more symptoms, even though it's protecting the kidney. Steroids can lead to a lot of undesired side effects. And our newer medications, we're only learning how to use them. There are several new approved medications, which we'll talk about later. Luckily, their side effect burden seems to be more tolerable, but despite our desire, we really haven't found ways to improve quality of life. We actually hope not to worsen it in our effort to stabilize kidney function and prevent dialysis or transplant needs down the road.
Okay, and I guess the last question I had about the quality of life is, I wonder what differences you see in older and younger patients.
Yeah, it's a great question again, and you could ask male versus female as well. But I think this is a disease that typically affects young patients. In the US, we see a slightly male predominance of patients. And I think you've got more reserve. You would think, oh, well, young people are going to do better than older people, and that you'll see these side effects of fatigue and pain more playing out to really disable older patients. And to an extent that's true, but I think it's more remarkable when you see people in their prime of their lives, in their 20s and 30s. And excuse me if that sounds a little ageist, but I think you can really sympathize more that these people who are supposed to be busy creating their job trajectory, get their families organized, support them, have a harder time fulfilling that. And we need to really address this better. Again, there's really clear evidence that patients with IgA nephropathy have a reduced quality of life, and we need to figure out strategies to improve that.